Hi, this is Togo. This is a reminder for slide your right foot toward the space under your left knee in supine. Let's lie down on the floor. Take a moment to notice overall sense of how you are contacting on the floor, your body print. How are you resting on the floor? Where does your attention go first? Do you notice the places you are touching or places you are not touching? Do you notice places where you are comfortable or where you are not comfortable? How is your left leg resting on the floor from your left heel to your left hip? What part of your left heel is contacting on the floor? Outside, back, or inside of the back of your left heel? What part of your left calf are resting on the floor? Does the back of your left thigh touch the floor, or is it lifted? How does your left buttock rest on the floor? How about your right leg? How does your right heel rest on the floor? How does your right calf rest on the floor? What part of the back of your right thigh are touching? How does your right buttock contact the floor? Are there any differences in your leg length? Are there differences between how one leg rests on the floor compared to the other? Notice your left arm from your left fingertip to your left chest. Which way is your left palm oriented on the floor? Towards the floor, inward towards your pelvis, or forward towards the ceiling? What part of your left fingers touch the floor? What part of your left hand touches the floor? What part of your left forearm is resting on the floor? Back, side, or front? How does your left elbow touch? How does your left upper arm rest on the floor? How does your left shoulder blade rest on the floor? Notice your right arm. Which way is your right palm oriented? What part of your right finger touches the floor? How is your right forearm resting? Your right elbow, your right upper arm, your right shoulder blade? Are there differences between how your right arm rests on the floor compared to your left arm? Bring your attention to your pelvis. Does your tailbone touch the floor? How does your sacrum between your hips rest on the floor? Resting closer to the bottom of your sacrum towards your tailbone, or closer to the top of the sacrum, or whole back of your sacrum flat on the floor? Notice above your sacrum going towards your head. How much space is available under your lower back? Is there enough room for your hand to slide under your lower back? How far up your back does that space reach? Does your lower ribs rest on the floor or away from the floor? In the middle rib cage, mid-back, at the bottom of your shoulder blade, touching the floor or away from the floor? Between your shoulders and pelvis, how much of you is resting on the floor? How about between your shoulders? What part of your spine, upper back, rests on the floor? Which upper back rests fully on the floor? How much space is available under your neck? Is your upper back part of your arch of your neck? Is there more space at the back of your neck than the back of your lower back? What part of the back of your head is touching? Middle, little bit down, little bit up, little to the right or to the left. Notice even though you are still, your body print is not static. When you breathe, your contact on the floor changes slightly. When you breathe out, can you feel the places where you press more into the floor or places where you press less? How does that change when you breathe in? Where do you press more? Where do you press less? Take a moment to feel overall sense of how you are contacting on the floor, your body print. Bend your left knee, put your left leg standing and left foot flat on the floor. Very slowly, begin to bend your right knee and slide right foot toward the space under your left knee. Don't go all the way, just a little. Do the beginning of the movement. Make the movement easy and simple. The question is not so much how far you go, nor how soon you get there. The question is what happened at the very beginning. Repeat the movement several times so that you can get a clear sense of all of the different places that are involved. How does this movement change your body print? Can you sense this movement from the floor's point of view? What happened to your pelvis, your lower back, your ribs, your upper back, your shoulders? Does one shoulder press more fully as you bring the right foot toward the space under your left knee? How is your breathing at the very beginning of the movement? Do you inhale, exhale, or hold your breath? Stay in really easy movement and easy breathing. You don't have to push harder, nor go farther. Can you begin to feel what isn't participating? What stops from going farther? Stop, lengthen your legs and rest for a moment. Notice what changes. Bend your left knee, put your left leg standing, left foot flat on the floor, and keep your right leg straight. Very slowly, begin to roll your pelvis a little bit to the right. Little bit means you could do a lot more. It's an eighth or less of what you could do if you did all of what you could do. Move left side of your pelvis a little bit away from the floor and roll your pelvis to the right. Shift your weight slightly to the right. So the point of the contact behind your pelvis, roll from being somewhere in the middle to a little bit to the right, maybe quarter inch or inch. Just a little bit movement. Roll your pelvis to the right. Left side gets less contact and the right side gets more. When you roll your pelvis to the right, do you roll your right leg more outside? Does your right heel roll on the floor? Is the orientation of your right knee change a little bit? Or no movement in your right leg? What happened in your belly, your waist, your lower back, your chest? How far up of your rib cage do you feel the movement? When you roll your pelvis to the right, what happened with your left knee? Does your left knee tilt a little bit to the right, or to the left, or not tilting? Tilt your left knee to the right slightly as you roll your pelvis to the right, as if you don't have a hip joint in the left side. Move your pelvis and your left knee together. Use the left leg as a handle of your pelvis. Do you feel more of tilting pelvis than rolling the pelvis? Moving pelvis, leg, spine, chest in your right hip joint, unless your right leg is rolling. Can you do the movement of your pelvis only in your spine? Both legs move together. There is no differentiation in your hip joint. Stop for a moment. Tilt your left knee to the left slightly as you roll your pelvis to the right. Left knee goes to the left, Just a tiny movement toward the floor. Pelvis still roll toward the right. Left hip joint need to be open. Stop for a moment. Keep the left knee pointing to the ceiling as you roll your pelvis to the right. Left knee move towards your toes, away from your nose, as you roll your pelvis to the right. Is it easier or more difficult to roll your pelvis? Does your left calf tighten up or stay quiet? What changes in your upper back, shoulders? How does your right leg move on the floor? Stop for a moment. Bend your right knee and slide your right foot towards the space under your left knee. Find out if this movement is changed just from the movement of your pelvis. Stop and rest, stretching out your legs. How did this movement affect your body print? You can stop and rest anytime. How do you know a time to rest? When your attention is lost while you are moving, when you are getting tired, it's time to rest. If you get lost, just stop for a moment and come back to the instructions. Roll to your side and come up to sitting. Lean on your hands behind you somewhere by your pelvis. Place your fingers pointing forward if you can. If you are uncomfortable, put something under the heel of your hands to take pressure off your wrist to make it more comfortable. Bend your left knee, put your left leg standing, left foot flat on the floor, and keep your right leg straight. Roll your pelvis to the right. Take your left side of pelvis off the floor. What happened to your left knee? What happened to your right leg? Bending at your right knee or rolling right leg? How soon right leg starts rolling when your pelvis rolls? Simultaneously, or are there any lag? Can you feel the pressure on your hands is changing? When you take left side of your pelvis off the floor, do you press more with your left hand or your right hand? Tilt your left knee towards the right slightly as you roll your pelvis to the right. Your left leg and your pelvis move together as a piece. So less movement in your left hip joint. Tilt your left knee toward the left slightly as you roll your pelvis to the right. What happened with the right leg? Roll more or less than before. What happened with your back? Does your back arch? Flatten? What happened with your hands? Pressure changes. Stop and roll onto your back and rest. Take a moment to notice how you rest on the floor. Is there some kind of trace left? New sensation from the movement you just did? Bend your left knee, put your left leg standing, left foot flat on the floor. Slide your right foot toward the space under your left knee. Find out what was the effect of the movement in sitting. Just do a few times. Has it become a little easier? Leave your left leg the way it is and bring the bottom of your right foot to touch the inside of your left foot. Your left heel to your right heel. Your left big toe to your right little toe. Your right knee is hanging out to the side. Very slowly slide your right foot forward. Bring your right heel toward the left big toe and come back several times. Your feet are parallel. Make the movement small, simple, and easy. How does this affect your breath? Rest for a moment. Go other way. Slide right foot toward your pelvis. Bring the pace of your right little toe toward your left heel and come back several times. Keep it simple and easy movement. How are your knees, your hips, your pelvis, and your back participating in the movement. Are you tensing your neck and jaw? What are you doing with your breath? These directions are not destinations. They are directions you are aiming to go, but you don't have to get there. Combine those two movements and slowly slide your right foot away from your pelvis and toward your pelvis several times. Keep some part of your right foot in contact with the left foot the whole time. Come back to the beginning position, both feet parallel. Rest for a moment. Keep your right foot still and slide your left foot forward. Bring your left heel toward your right little toe and come back several times. Keep your left foot light on the floor. Slide easily and come back smoothly. Keep your whole left foot stay on the floor. What happened with your breathing? Can you sense this little movement of sliding left foot affect your body plan? Does your pelvis roll a little to the right or to the left? Does your lower back move toward the floor or away from the floor? Does the movement of your foot reach your head? Stop and rest for a moment. Keep your right foot still. Slide your left heel toward your pelvis. Bring your left big toe toward your right heel and come back several times. Find a way to do smoothly. What happened with your left hip joint and pelvis? The movement of your left foot in your left ankle, your left knee, and your hip. If your pelvis is moving, it's also the movement in your spine and perhaps in your right hip joint. What happened to your lower back? Are you arching your lower back or flattening? Are you rolling your pelvis to the right or to the left? Stop and rest for a moment. Keep your right foot still. Combine those two movements and slowly slide your left foot away from your pelvis and toward your pelvis several times. Keep your left foot flat on the floor. How's your breathing? Stop and straighten out your legs and rest for a moment. Roll to your side and come up to sitting. Sit in the same position with the left leg standing, your right leg out to the right, and your feet touching. Slide your right foot away from you. Bring your right heel towards your left big toe and come back several times. Find out how smoothly you can do. About the other way. Slide your right foot towards you. Bring your right little toe towards your left heel and come back several times. Slide the right foot away from your pelvis and toward your pelvis, forward and back several times. When your right foot slides away from your pelvis, the distance between your sitting bone and your heel increases. Your right foot slides toward your pelvis, the distance between your sitting bone and your heel decreases. Can you sense that and feel it? Can you sense the movement in your pelvis, back, neck? Stop and rest for a moment. Slide your right foot forward and back while maintaining the distance between your pelvis and your right heel all the time. Only way you can do is by lifting your pelvis off the floor and slide your pelvis and foot together. Your right knee does not have to change angle. The distance between your right foot and pelvis stays the same. Stop, sit up, rest for a moment. Come back to the same position. Keep your right foot still and slide your left foot forward and back while maintaining the distance between your pelvis and your left heel all the time. Keep your feet touching. Do you feel your left foot moving and past your right foot? Do you feel your right foot moving past your left foot? Can you do this movement with maintaining your breath nice and easy? What do you do with your lower back to assist this movement? Stop, lie down and rest. How have these movements affected your contact with the floor? Bend your left knee, put your left leg standing, and slide your right foot toward the space under your left knee. Is this movement a little bit easier now? What changes to make the movement easier? Leave your right foot along the path under your left knee where it is easy and comfortable. Reach your right foot with your left hand. Don't reach your right foot right away, even if you can. Just begin to reach in that direction gently and easily. Notice the quality of the movement. If it is easy, when does it change the quality of the movement? Notice the path of your left hand making on the floor, line or arc. What do you do with your head, your chest, your rib cage, your pelvis, your shoulder girdle, your arm? Look for the path of the least resistance. Work on easier and smoother. It's not about going farther. It's about clear and smooth movement. Get rid of any bugs, any forcing. How far do you go without pushing? Notice which place helping, which place hindering. Stop for a moment. As you reach your right foot with your left hand, slide your left ear towards your left shoulder. Tilt your head towards your left shoulder. Tilt your head without turning it. Your nose stays oriented towards ceiling, looking forward. If you are tilting, the part of your head contact on the floor remains the same. If a different part of the back of your head is touching the floor, when your head is closer to the shoulder, you are turning your head. Can you slide your head to the left only as far as the same part of the back of your head touches the floor the whole time? It doesn't have to be a big movement. It's more important to have clear and smooth movement. As you reach your right foot with your left hand, tilt your head several times to the right, your right ear towards your right shoulder. Make it very small and easy movement. Keep the same part of your back of your head touching the floor the whole time. Make your head a little lighter and slide your head easily to the right while breathing. As you reach your right foot with your left hand, tilt your head a little bit to the right and a little bit to the left, very easily. Stop, straighten out your legs and rest. Bend both your knees up, feet flat on the floor, roll your head to the right without tilting your head, actually spinning your head around the long axis. When you turn your head, the different part of your head will be touching the exactly same place on the floor the whole time. Turn your head to the left without tilting your head. Different part of your head touching the same place on the floor. Now turn your head a little to the right and a little to the left without tilting your head. Going as far as you can, that's not a little. Going half as you can, that's half, that's not a little. Quarter, let's say 1/8 as far as you can go. 1/8 of the range of your comfortable movement. Turn your head to the right and to the left. 1/8 of the distance you know you can go in each direction. So you can listen to the very beginning instead of asking how far do I go. Ask yourself what's like to begin. Stop. Straighten right leg out and slide your right foot toward the space under your left knee. Stop somewhere comfortable. With your left hand, begin to reach your right foot. Notice what you do with your hand. Is your head participating or bystander? Tilt the head to the left as you reach with your left hand down. Imagine there is a string between left ear and left shoulder. As your left hand reaches down, your shoulder and your head slide down, following your left hand. Tilt your head to the right as you reach with your left hand down. Left shoulder goes down with the direction of your left hand is. Left ear moves away from your left shoulder. Right ear moves towards your right shoulder. Look towards right shoulder as you reach with your left hand down. Look towards your left shoulder as you reach down with the left hand down. See if you can feel the difference clearly. Which of those do you like? Which feels more natural, more comfortable? Which combination do you like? Which are unusual? How do you feel? Stop and straighten out your legs. Rest for a moment. Bend your left knee, put your left leg standing, slide your right foot towards the space under your left knee and reach towards your right foot with your left hand. Can you put your right foot towards the space under your left knee more easily? Can you reach with the left hand towards your right foot easily? How is that journey? Just do what's easy, then stop before your left hand and your right foot touch. Stop before you struggle. Imagine you have a stick between your right foot and your left hand. Keep the distance between your left hand and your right foot the same. As your left hand and your left arm slide down towards your right foot slide down as if your right foot ran away from your left hand. As your right foot slides up towards your left hand and your left arm slide up as if your left hand ran away from your right foot. Feel where do you move to do this. Stop for a moment. Bring your left hand and your right foot a little closer together and a little farther apart. How is the distribution of this movement? How much of your body participates in this movement? Feel every part of the chain of motion participate in this small movement. Stop for a moment. Straighten your right leg out all the way and slide the right foot toward the space under your left knee. Sense and feel how much of yourself participates in the movement. Stop for a moment. Change over your legs. Bend your right knee and right foot standing. Straighten your left leg. Slide your left foot toward the space under your right knee. Feel what it's like the direction on the side you haven't explored the movement. More effort, rough. Try to make it easy and smooth and see what happens. Stop and rest your legs in comfortable position. Take a moment to notice your body print. How much of you are available on the floor? How does your left leg rest on the floor? How does it compare with your right leg? How does your left arm rest on the floor? How does it compare with your right arm? What changed compared to the beginning? How much of the back of yourself between your shoulders and your pelvis rest on the floor? How does your head rest on the floor? Take a moment to listen to your breath. How does your breath change the contact on the floor? How does the overall body print change? When you are ready, roll onto the side to sit up and slowly take a time to stand up. Have a little walk. How is this movement affected you? What's the difference how you express yourself now? What habitual movement pattern changes? As long as you are moving towards comfort, you are learning something. Thank you very much. Have the best day of your life.